Module 3. Metabolic changes following a concussion. The violent movement of the brain inside the skull produces an alteration of consciousness in several ways. The long axons of neurons that connect the lobes of the brain are vulnerable to stretching and shearing. Sometimes these axons are unable to fire and the neurons lose the ability to communicate with the lobes of the brain. With concussion, the most common cause of an altered state of consciousness is the metabolic changes that occur. The violent movement of the brain causes cells to release potassium. Potassium is the chemical inside the neurons and it is responsible for carrying information. When the potassium is outside the neurons either have difficulty firing or they may fire inappropriately. In severe concussions, inappropriate firing causes convulsions. The metabolic changes that occur with concussion include a series of other effects on the brain. Scientists refer to these effects as a cascade. One of the effects is to cause the blood vessels that feed the brain to reduce the flow of blood. The cascade of changes does not occur immediately, so the visible effects of concussion, such as confusion, sometimes get worse over the 30 to 60-minute period as the cascade of metabolic changes unfolds. Research on concussion indicates that these metabolic changes may take 7 to 10 days to return to normal. These metabolic changes appear to last longer than the symptoms experienced by the concussed person. There are no tests to gauge the extent of metabolic changes, but there are tests to assess the person's level of recovery.